Hello, and how are you? Welcome to another episode on the nursing case study or nursing care case study guide. And in this series or in this segment, we are going to focus in depthly on the nursing case study guide. So, for those who've been following, we've been doing a series pertaining to healthcare case study. And in the nursing care case study, we've done the different step by step, how to compile all these steps in the required ways. And we've explained all these parts like in detail. And if you missed out, don't worry, you can refer to our playlist on the nursing case study guide, and then you can like read in details how the different parts we've discussed on. But in this part, I saw it fit that I compile a summarized guide that will show what parts begins, and as you write, how do you organize it so that the document becomes more clear, well organized, and articulate. So stay with me all the way to the end. And for those who are new, my name is Winnie Barawa, and this channel focuses on lessons, lectures, and expert interviews pertaining to healthcare. Don't forget to subscribe, join our community by clicking on the join link there, and you can also comment, give us some preview or feedback pertaining our lessons or even just this video that we are doing currently. So let's see, when you are writing this healthcare case study, how do you begin or which parts do you begin? How do you put them together? That's the main reason for this guide. So if you are in the process of writing one, you can use this to know how to place your main topic, the subtopics, and the segments as you develop them. So the first part of the guide begins at introduction. So of course, if it's a institutionalized document, for instance, you're supposed to submit it as a document, you will have the first cover page, which has your name, it has your department, it has your, admission number or college numbers, and it will have somewhere there where you're signing as the owner of that document. But after that, we are going now to go to the main part, and that is the introduction part. So in this first part of our nursing care case study under introduction, we're going to have the information organized, like starting with the patient biodata, chief complaints, history of presenting illness, followed by the past medical and surgical history, the socioeconomic history, family history, the drug and food allergies, other histories if applicable. Remember, these are histories that may not really be applicable for all the clients. It depends on the illness. And then we have the physical examination part, the vital signs investigations, and then you finish the last bit, what is synthesis or diagnosis, which can be either medical or surgical. So this is the first part of the case study. You can just give it a main heading there, like introduction, and then you start now with the data. So biodata, you flow with it until this chapter, or I really didn't want to call it a chapter. I just wanted to call it a part or a beginning section so that it ends with diagnosis. So if you're wondering how will I extrapolate all this information, we've done different data or different parts of this, and it's focusing more. If you're going onto our playlist to refer to this bit, you can refer on the video on history taking, and then you can refer to the video on physical examination. It has all this information explained comprehensively. But if you're organizing the work in your document, you begin with the first part, that is introduction, or section 1, introduction, and then you organize that work under these following subheadings here. So these are the subheadings. So if you're writing and this is your main top part here, you'll write introduction, then you start with patient biodata. Those will be your subheadings, physical examination until you finish diagnosis part. So that's the introduction part of our step by step or of our nursing care case study. And then we flow to the second part of our nursing care case study, and that is the patient admission. So under this second part, being about patient admission, these will be the subheadings that we are going to introduce. So under the patient admission, we're going to have subheading number 1, which is type of admission. Subheading number 2, the general survey, reaction to hospitalization. We're going to go with the immediate management on admission of the patient, and then you're going to provide subsequent management of the patient until discharge. And the last part of this or patient admission is the patient discharge here. So how is this going to work? Again, we're going to use the same way we did under introduction. So we're going to introduce a second main heading, and that is patient admission. Then under patient admission, we shall have the subheading. So that's be like 2.1 type of admission, 2.2 general survey, 2.3 reaction to hospitalization, and then you're going to discuss these parts in details. Again, if you feel lost and you don't know how will I be describing these different parts of the patient admission, we've done a whole full video on patient admission and how to describe all these parts in details. So you can refer to our playlist on the patient admission video and get to understand how these parts should be put together. But I will still attach a link on this so that you can refer to it, and then you can, read more about it and be able to compile your patient admission section. And the third segment is on literature review and disease description. So in the literature review or disease description, we would like to describe in details pertaining to the disease and any components that needs to be known about this illness. So most of the time here under literature review or disease description, we'll need first to introduce the topic or the disease diagnosis itself. Then we begin this. So I'll have introduction. So that introduction part here, we are doing a brief analysis of the disease burden, like what is the prevalence of this disease, what is the current challenge, like just tell us about that disease briefly, and then you flow with the definition, the anatomy, the diagram of the anatomy of the affected system by naming its parts, describing the changes, and then you go to risk factors, you go to etiology or causes, followed by pathophysiology. Literature review doesn't end at pathophysiology. It flows to the next part. So I want to proceed to the next part that I can show you what it entails. So after pathophysiology, we go to clinical manifestations. We bring in diagnostic tests and investigations, management, that is medical management, surgical management, nursing management, including the nursing process and the nursing care plan, and then any other management that can be done or is going to be done for the patient, and then complications and the health education. So these are key parts of literature review or disease description when you're giving it in details. Now, again, for those who are wondering or have not yet watched or have not been with us on the step-by-step guide, you can refer to video done on literature review in nursing care case study. It explains all these parts detailed, like how do we put these parts in details? What am I supposed to write when I'm doing the diagnostic test? When I'm writing clinical manifestation, how are these parts supposed to be compiled? So these are part of the literature review and the disease description video. And then to go on again, we are told you can also give further description when it comes to comparison of actual management and the ideal management. So after you are done with the health education, there's that comparative management that you need to do, like on ideal management versus actual management. And you're told the key focus, should be focusing on risk factors, etiologies, clinical manifestations, diagnostic tests, medical management, surgical management. Don't forget nursing management. Don't forget other management. Like here with ideal and actual, you want to focus on each and every part of management that is important and was implemented for our patient vis-a-vis what is ideal from the books. So if you're still stuck, I will repeat, you can refer to the literature review video and it has detailed explanations on how to handle this part. The fourth segment is on the home visits. So with the home visits, you begin this part with home plans or the home visit plans, where you're going to show us when are the visits going to happen, what are the objectives for each visit that you're going to conduct, and then we start by giving now the report for each and every visit, from first visit, second home visit, the third home visit, all the way to the fourth home visit, describing these visits in details, attaching the lesson plans that have been used in the second and third home visits. And then in the fourth visit, you're describing the termination visit, what happened, and any plans that you have now that you're terminating the visits. So we have all these videos already done, and we will still attach links so that you can refer to all of them for you to have a detailed way of understanding it. But this is the fourth segment that follows, or this is the fourth section that follows. So we'll have again there like a main subheading like home visits, and then you begin with the visit schedule. So you align the visit schedule, like first visit will happen on this date, you explain their objective and you bring it on. Then second visit date, the objectives and what you expect of it. Third visit, you show the date again and the objectives. So that's how you organize the fourth section. But now you need to have a major subheading that is on the home visits. And then after the home visits, we have the last part of our nursing care case study. And in some books or in some guides, they can actually bring this under the home visits, although in a way I feel we just have a segment of its own, like where we talk about summary and conclusions, so that you have the first part that is summary, conclusions, recommendations, bibliographies, and appendix. So if you prefer putting them under home visits, well and good. But for better for better and more clarification, it's easier if you do it as a segment of its own or a section of its own. So you have just a section on summary and conclusions, or summary, conclusion, and recommendations, so that this is on its own and you're bringing in together all these parts secluded, or rather discussed independently, so that they don't look like they are part of the home visits. And in this case, you're trying to summarize about the home visits. No, you want to summarize and conclude on the whole case study. So that's this segment is all about. So for me, I will advise, if you like doing the same, just have an independent segment with its major title, summary, conclusion, and recommendation. Because here you are concluding about the case study, you're not concluding just about the home visits. You want to give a bigger picture, a summarized picture of the whole case study, not just the home visit. So let this be an independent section. You are describing it independently. And that's how the guide looks like. So it has 5 parts. So we have the first part, that is the introduction, and then we go to the second part, that is the patient admission, and then we went to the third part, that is on literature review, and then we had the fourth part, which is on home visits, and the fifth part is summary, conclusion, and recommendation. So I hope this really helps, and it can give you more details, or it can help you summarize your work and make all these segments really interesting. And hopefully you pass your case study guide work, or you enjoy your case study guide writing journey. And if you're really stuck, you can still write up us on the comment and see how we can help you. And I always appreciate that you stay with us all the way to the end. And those who've not yet subscribed, kindly give us a subscribe, share our work in your platforms, give us a comment or feedback. Do you like our work? And like the video, just click on the thumbs up button. It really gives us a good milestone, and we appreciate all these little things that you do on our channel. So thank you so much guys for staying around, and let's meet in the next videos. Bye bye.